Hi, my name is Amber. I'm going to take my second skill assessment video. Before I started, I prepared my gloves and tuning fork, otoscope, and thumb blade. I don't need any the PP because my patient doesn't have any contagious disease except this the glove for today's assessment. Let's get started. I need to wash my hands first. Hi, my name is Amber Kim. I am your nurse practitioner patient. I am your nurse practitioner. Could you tell me your name and date of birth?
My name is Sunjin Kim, and my date of birth is April 19th, 1983.
Thank you. So today you are going to do the assess the ears and nose and mouth and the pores. Is it okay for you?
Yeah.
So first of things, I need to inspect your general appearance. You look healthy and well nourished. Your clothes are clean. You're well groomed, and your posture is online. You look like no distress. So now I'm going to inspect the ears, the both side. Okay, so I just inspected the auricles. So there's no deformities and no masses and no skin lesions both sides. Now I'm going to palpate both the auricles and the tragus and mastoid. Do you have any tenderness?
No.
Here?
No.
No? Okay, so the auricles and tragus and your mastoid bone is no tenderness and no nodule and no edema. Okay, so now I'm going to check the inside the ear canal, and I'm going to check the tympanic membrane. So I am holding this otoscope in my right hand and using my left hand. So I need to light up first. And then using my left hand, I need to pin it up and backward and introduce my otoscope inside, downward and inside the patient ear and look at the ear canal and tympanic membrane. Okay, the same way in different hand. Otoscope with my left hand and with my right hand pin it up and backward. Thank you. So the ear canal, there's no discharge, no erythema, no the foreign bodies, and then no edema, and then no masses, but I can see only a small amount of yellow cerumen to both sides of ears. And now I am now yeah, your the tympanic membrane. The color of the tympanic membrane is pearly gray, and then the translucent and with the normal contour. And then I can see the visible the malus, and then the corner of the light, the right side of the ear is the 5 o'clock, and I can see the left side of the ear, the corner of light is 7 o'clock, and both are no perforations are noted. And yeah, both ears are the same. And now I am performing the Weber test. So with this the tuning fork. So I am placing this the tuning fork near the top of the head. So please tell me you can hear the equally the both side or louder the other side.
It's equally both sides.
Okay, so you can hear the sound of the equally the both sides, so it means no lateralizations. Next one is a Lunette test. So this is for the screen test for the conductive hearing loss. So I'm going to place this tuning fork the behind your the ear, the mastoid bone, and the front of the ear. So you can tell me when you cannot hear the sound. Okay.
Yes.
Okay.
Yes. Yes.
Okay. Your the both ears air conduction is greater than the bone conduction. This is normal findings. Okay, so next one is I am the inspect your the nose. So could you take off your the glasses? So your nose are the symmetry and any no symmetry and no lesions and no deformities. May I palpate your nose? Any tenderness?
No.
So your nose, there's no tenderness and no masses. And then I palpate your the frontal and maxillary sinuses. If you have any tenderness, please let me know. No tenderness, no pressure.
No.
Both your the frontal and maxillary sinuses, no tenderness. So I am examining your the inside of your the nose using my otoscope with the light. Okay, thank you. So your the nasal mucosa is pink and the moist and no swellings and no bleeding and no exudates and no ulcers and no polyps. So it looks good. And then your the septum is the midline with no deviation and no inflammation and no perforation. And now I'm going to inspect your the mouth and the pores. So first of things, I need to check your the lips. Inspect your lips, and your lips color is pink and moist, and no cracking and no cracking and no scaldiness. Okay. So may I see your the gums and teeth first? I need to wear my gloves to check your the inside your mouth and no, your the gums in. Could you open your mouth? Your teeth, mucosa, hard palate, soft palate. Could you say ah? Ah. And could you stick out your tongue, please? Stick out your tongue. Yeah. Thank you. Thank you so much. Okay. So I inspected your the oral mucosa. The color is the pink, and there is no abnormal the pigmentation. So and there is no ulcer or no white patches and no nodules. The mucosa is pink and intact overall. And also I inspected your the gums. The color is the pink, and no swelling and no ulceration and no bleeding and no retraction. It looks healthy. And your teeth, there's no the caries and no abnormal positioning. Your the teeth alignment is good. Positioning is good, and then there's no missing teeth. That looks good. And then I also inspected the hard palate. So the color is pale pink, and there is no lesions or any the abnormal the masses. That looks good. And I also inspected your tongue. The color is pink and normal texture, and there is no lesions. Looks good. And I inspected the purines. The color is pink and no swelling and no lesions. They both are the symmetry. And I also inspected your soft palate and uvula, and uvula is the pink midline, and your soft palate is the pink, and they are elevated symmetrically when you say that make a ah sound and so phonation. And I also inspected your the tonsil, and then the color was the pink. There was the also and no no swelling, and they both sides is symmetric and no X-stays. Your the tonsil is a size +1 bilaterally. So overall, your the finding is normal. So do you have any questions?
No.
Okay. If any have further questions, please let me know. And thank you for coming today.
Thank you.
Bye.